As you see in this picture, we have two pictures. This is a double picture actually for the uterus before and after introduction of Doppler ultrasound. Of course, this is a transvaginal approach, and as you can see, this is a longitudinal diameter of the uterus, or a longitudinal section. This is the endometrial cavity and the endometrium here. So it's very important to imagine where is the line of the endometrium or the endometrial cavity, and this is very important. And if you know that this case was a case of molar pregnancy, and that picture is post evacuation, after evacuation of this molar pregnancy, and unfortunately there was a misdiagnosis or misinterpretation of the picture by someone who mentioned that there is still contents. And unfortunately also, when I published this picture in the page Obstetrics and Gynecology Ultrasound for All page, and you will find it published on 25th July 2025, in the year 2025. Unfortunately, many of our colleagues had mentioned in their comments that these are retained products of conception, and that was the same false impression. So you should know where is the endometrium. This is the endometrium and the endometrial cavity, and so this area is in the myometrium, not in the endometrium. And so the false impression here was that there is still products of conception. That one of the impressions. Another impression was actually depending on the presence of this very high vascularity after introduction of Doppler ultrasound, and they said that it may be arteriovenous malformation, AVM. Actually, the entity of AVM needs a separate lecture to mention what is the terminology of AVM, or what is actually the meaning of AVM, and how it changed actually as a terminology or as a meaning. But actually, if you know the history of this case, that it was a molar pregnancy, and that was a post-molar evacuation picture by ultrasound, and that picture after introduction of Doppler ultrasound, and how that Doppler is showing a fiery appearance. And of course, that means that the Doppler is markedly showing a very high vascularity, and that fiery appearance actually meaning that there is a very high vascularity of this area. So that is a case of invasive mole. There is an invasion of the myometrium, and of course that means that we changed, or we had another step, not just a molar pregnancy. Actually, this is a GTN, or gestational trophoblastic neoplasia. And of course, you should have a lab investigation for this case. For any case of molar pregnancy, you should have a post-molar serum BHCG tetra follow-up, and it should reach 0 before any other intervention. Actually, it may end in choriocarcinoma. Some cases or some conditions may end in choriocarcinoma. That's why we follow up these cases not only by ultrasound or by Doppler or by serum BHCG tetra. It's very important and is a very critical case. So please know how the molar changes, or how the invasion or the invasive mole is appearing, in which there is an invasion of the myometrium in cases of molar pregnancy. Thank you.